long.
Mm.
Do you remember the rat from Ratatouille and how it pulled on the hair to control the guy?
Ага.
Это как блой. Блой, я не поняла. Ты никогда бы от меня не убежал. Это
Подожди,
блой.
Лен, да я разберусь.
Блохи меня боятся.
Hey, hello everyone.
Hello, Professor.
Hi.
Hello, hello, hello.
Hi. Hi.
Hi,
Hello.
Professor. It's Jeanette. Sorry, I don't know what's going on with my camera or my chat box today. My camera is black and my chat box still says I can't send messages.
Maybe you might want to kind of log out and log back in and try to join again.
Okay, because I've tried it twice and then I actually logged on using the link on Outlook as well.
Yeah, that's usually one reason that if somebody hasn't accepted it, usually that's the reason. It doesn't let you do anything there, but it's not the only time, or you're not the only one who still experienced it. It's, you know, it's just a technical thing. I don't know. Maybe next time, maybe try calling Teams and see if they can help you. I'm not sure what fix they have, but some students in the past as well, they experience the same issue.
Okay, sorry about that.
No problem. Permeet, you have a question?
No, Professor. I'm okay. Thank you.
All right, all right. Everyone else, please turn your cameras on. As I said last meeting as well, if you're here, I want everybody to have your cameras on. Unless somebody is in a situation and you guys kind of inform me in advance. But everyone else, please turn your cameras on. Deborah, Clarissa, Elaine, Christy, Jan, May, please turn your cameras on. I hope everybody hear my message. It applies to everyone. Everyone means everyone. Please turn your cameras on. Because I'm not getting a response from you. If you're not turning it on, I'm sorry. Then I don't think it's a good idea to be in here. Because I don't even know if you're there or not.
Hi, Professor. This is Clarissa. Sorry, I have a newborn. I'm feeding my newborn. He's just
Okay.
9 weeks old. I'm just waiting for my fiance to get home, and then I'll turn my camera
Thank
on.
you. Thank you for letting me. Thank you.
Sorry about that.
I completely understand, guys. Look, all I told you even the first time, communication, just let me know. I understand there are things when we can't do what we should be doing, so that's okay. But as long as you let me know. Jan, can you hear me?
Yeah.
Okay, I do not see you.
I'm on.
I don't see you on the camera.
I see me in the camera.
Yep.
Do you see me?
I don't. Anybody else? Anybody else see? I don't see. Oh, you do? Okay. Looks
Do you see
like
me?
there's some magic trick you're playing with me. I can't see you. But somebody did said they
Thanks,
can
Myra.
see you.
Maria.
Okay. All right. So everybody's ready? Ready for the show? Yes?
Yes.
Yeah, everybody's so excited that everybody shouted, right? Like, yay! Come on, are you guys awake? Have some coffee, tea, guys. Wake up! All right, all right, right. It's a classroom, right? It should be some sort of noise. Not so quiet. Okay. So. One thing I want to talk to you about before we start our session. A couple of students reached out to me, asked about, the assignments due because of the holidays coming up. Okay, right. I saw that. Um, okay, I looked into it, and if we make any changes, it's gonna make things a little complex for us. Okay, I understand that you need time with family, but trust me, if we make changes now, uh, the things are gonna be kind of scattered around because it's gonna push assignments backwards. Okay, and then you see like you don't have exams every week, they are at certain intervals. If you push it back, then you will have material on the exam which not even covered by that during the before that exam. I don't want to do that. Do you get what I'm saying? Because that's not an ideal situation. That's a mess. So I'm extremely sorry. Please apologize to you and your family. Just tell them to say whatever they want to say. Me, don't say like it's you who chose it. Just say the professor's right. He's like, yeah, whatever he did, it's all on him, right? And I apologize to him that it just you still have some work to do, but it'll keep things smooth. Okay, I hope you understand. I don't want to make it complex for you guys because then it's a lot going on. Um, which you don't see about the curriculum, the exams, and all that kind of stuff. Every day we have some meetings. We're trying to, make changes here and there, and it's a whole lot. And then at some points, if we make any changes, that's a huge mess, and this is one of them. So please just kind of work ahead on your assignment so that you can have some time. And trust me, I'll be there for you as well. I'm not taking any day off that you need me on those days and I'm saying, oh no, it was holidays. No, I'll be there with you as well. Okay. I don't have a holiday. I'm not gonna take any holiday. We'll be there together. Okay. So let me share my screen and we can move on. And once again, my humble request that one thing I want you to understand that all these sessions we are doing is for you, nobody else. It's for you. Excuse me. So I want you to be here, not only physical presence, your 100%, your full attention. The reason I want you to make it most productive so that you can have your desired results. Did you, first of all, let me ask you, did you see anything or did you felt like that the last session helped you to do well in the exam? Yes? That's great. That's
Yes.
great. That's great. So as I said, I'm not going to leave you alone, but I want your help here that please stay focused and get involved, engage in these sessions so that you can maximize. The reason, when you see a question with 4 options, treat it as 4 questions, not one question with 4 options. If we do 50 questions, that technically 200 questions. You don't know what they're going to ask you, which option they create as an exam question. So read everything, and then every single question, do your best to evaluate the information given to you and answer it. Okay, I see often that some of the students, they get tired. I understand that, mental fatigue. You might just came from work. I know it's tough, but we need to do it. That's real important that you stay focused and involved in answering questions because I want you to make it productive, not just being present. Okay. All right. So let's move on, guys. Here, 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 and here, and here. Okay. Excuse me. Do you see my screen now? Full flash screen?
Yes.
Yes,
Yes.
I see it.
All right. Mhm. Did you go right there and right there and right there? Okay. First question of the day. Yeah, please try to kind of answer the question in 30 to 45 seconds so we can do as many as questions we can. Okay, so here I got maybe 10, 12 answers here, and everyone answered C, and that is 100% correct. So let's, excuse me, let's talk about it. Tolerance is something when patient is taking a medication from a long time. Okay, from a long time. So now the same drug, same dosage is not producing the same level of therapeutic effect, right? They may need the dose to be increased to produce the same therapeutic effect. Now, sensitization, that is incorrect. It describes the opposite phenomenon, where an individual becomes more sensitive to the drug. So that requires decrease in the dose, right? Resistance is that decrease in efficacy, for example, your antibiotics, right, against certain pathogens, not to the body's response to drugs, towards antimicrobial or antibiotic drugs. Dependence when the body adapts to the presence of drug, and as soon as you pull the drug away, your patient experiences withdrawal symptoms. Okay, everybody clear about all the options? Any question? Everybody's good? Okay, next question. You're educating a patient about OTC and NSAID for pain. Which are the following example of NSAIDs? You tell the patient, hey, you can take an NSAID. They said, I don't know what that is. Tell me a name. Okay, come on, everybody. Try to answer, and answer. Okay. Perfect. Yes, B is the correct choice. Ibuprofen, naproxen, celecoxib, ketorolac, which is Toradol. These are all your NSAIDs. Acetaminophen, it is an analgesic, right? And this is antihistamine, it's anxiety, aspirin, antiplatelet. So these are steroids, pain medication, opioid, albuterol, short-acting beta agonist. This is Lasix. And then once again, diphenhydramine, omeprazole is a PPI, anti-diabetic drug, and that's etimell for enzyme. So B is the correct choice. Okay, next. They're asking you, can you identify the drugs which are centrally acting muscle relaxant? Okay, great, perfect. Proud of you guys, very well done. Yes, A is the correct choice. Your baclofen, cyclobenzaprine, which is Flexeril, Tizane, Dean, which is Xanaflex, and methocarbamol, they are centrally acting muscle relaxant. Okay. Next, examples of opioid agonist. Okay, and I see A's and B's here. All right. Now, these are the drugs which are opioids or act on the opioid receptor to produce similar effect. And the correct choice is B as in B, B as in boy, B. Oxycodone, okay? That is an opioid. Morphine, hydromorphine, codeine, they're all opioid agonists. Now, on the other hand, for example, fentanyl is an opioid. Hydrocodone is, but methadone, and buprenorphine are not. Same with the C, naloxone, naltrexone, buprenorphine, they're not. And D, acetaminophen, ibuprofen, celecoxib, diclofenac, they're not. They're analgesics or NSAIDs. Okay, next. Examples of alpha adrenergic agonist. There are two different kind of drugs, and they're alpha adrenergic agonist, and then they're antagonist or blockers as well. But these are agonist. Agonist means which produces similar type of effect. Now I can see a mixed response here, A, B, and a D, but majority A and B. The correct choice is your A, your clonidine, methyl-dopa, prazosin, tamsulosin. These are your alpha adrenergic agonists. Your clonidine and methyl-dopa, they are centrally acting alpha-2 agonists. Okay, now they all reduce the blood pressure with different uses. Your prazosin, it's our alpha-1 antagonist. It is used to treat hypertension. Okay, if we look into things that are mixed up in here. Now, if you look at tamsulosin, the option has tamsulosin, right? Tamsulosin is for BPH, blocks the alpha-1 receptors. BPH, benign prostatic hyperplasia.
Professor, I have a question.
Mm-hmm.
What is the easiest way to remember all this? This is just too much to.
Okay. Look,
like.
I'm not gonna ask you a lot about this way that you have to remember, but I want you to know in deeper so that you can kind of take notes and at any point if you need to answer any question you asked, test it on anything, it. The best way the question you ask is to remember them is like have a notebook, piece of paper, some of them, write down on top, like, for one, for example, here, alpha adrenergic agonist. On the opposite side, write down the antagonist. Okay, on one page you have agonist, one have antagonist, right? So, for example, beta adrenergic agonist. Okay, on the other side, beta and adrenergic antagonist. Their other name is beta blocker. Okay, but they may use different type of names how they're called, but it's the same thing. Write the heading, okay, write the heading, and then write 4 or 5 most common drugs under that class. Let me give you an example, and that's a good question. For example, in the question, you have to determine if this drug belongs to beta blockers or not, okay, beta blockers or not. Maybe you know that, hey, this is beta blocker, this is how beta blockers work. Or on the other hand, you know a drug, but you don't know what class it belongs to. How to connect it, as I said, piece of paper, write down on top, beta blockers. Under that, write down 4 or 5 commonly used drugs and write a hint for you. Hey, without memorizing all the drugs, which hint should I remember, which can help me to identify if this drug belongs to that class or not? Now, the example is beta blockers, they end with LOL. Metoprolol, atenolol, propranolol, they end in LOL. Now, as long as you connect that, you know, either they can ask you as a class or as a drug, you know they belong together. Make sense? So this is the way you develop those lists and then leave the hint there. It's not hard. It's not hard. It just needs a little bit of work by putting them on different piece of papers and just understanding by leaving a hint there. Make sense? Okay.
So what's the correct answer?
Oh, what did I tell you?
A.
You told A.
Okay.
Is it A?
Do we agree or not?
I-
Or is that a second question?
I'm not
Yes.
sure.
It's A.
Yeah, it is A. Just kidding. Yes, it's A. All right.
So why not D?
Which one?
Alpha adrenergic agonist.
Okay. Now, hydralazine, they're nitroprusside, dometamine, norepinephrine. They are not alpha adrenergic agonists. They belong to different class. Hydralazine and nitroprusside, they're vasodilators. Okay. Now, they may all produce the same therapeutic effect, but they belong to different class. Make sense? We're talking about the class here, not what the therapeutic effect is. So they all decrease the blood pressure, but different ways, and they belong to different classes of medication. Okay? In some of the options, maybe some belong to that class, but not all. All right, next. Now here, these are antagonists, opposite effect.
Which we would call blockers, yes?
Yes. Alpha adrenergic blockers. Good job. Okay, great. Looks like everybody is moving in the right direction. Excuse me. And in the exam, I'm not going to ask you like to identify 4 drugs in a row, but I'm putting in here so that you know more names from under that classes. Okay, so do you exposed to more names, which are commonly used. All right, good job, guys. A is the right answer. Okay, alpha blockers, they end with Zosine or losine, okay? Sin at the end. Doxazosine, terazosin, prazosin, tamsulosin. Okay, A is the right choice. Now, let me actually teach you how to connect things together, okay? Rather than individually thinking about them. Now, do you know how do they work? Alpha blockers? What they do? Okay, what are they used for?
It's for blood pressure, right?
Blood pressure, and they say is BPH, right? That's what it says for hypertension. Now, when somebody has hypertension, does anybody know what happens to the vessels? Experience vasoconstriction or vasodilation during the hypertension?
Dilation.
Constriction.
Dilation.
Constriction. Whenever there's constriction, the blood pressure is going to go high. Okay, so patient has vasoconstriction, which is causing high blood pressure. Now, that is the problem. Now, just think very simple. What is the solution?
Dilating.
Dilation, right? That's not rocket science. Somebody is having vasoconstriction, and that is the reason of hypertension. Well, vasodilate, blood pressure drop. Agree with me on that? Right? Now, next question. What do you think is the biggest concern or you should be monitoring for if the patient is taking this medication?
Hypotension.
Hypotension. Remember, the problem is high blood pressure. You're trying to fix the problem. What if you fixed a little bit too much? You're just a little too kind, right? And you fix it too much, the problem is now opposite to your original problem. Original problem was high blood pressure. Now the problem could be low blood pressure, hypertension. Now, as a super nurse, what should you teach your patient about? Do you think there is any risk associated with hypertension?
Fall risk.
Yes, they have fall risk.
Fall risk. So what should we tell them?
They need to get up slowly every time they sit down.
Yeah. Sit before you stand. Change position slowly. Do not take with anything else, which drops your blood pressure even more. Correct? We are on the same page? That's what's important. All right. Let's move on. Next one. Okay, for some of you, your cameras are still off. Jared, Princess, Sheikh, Fabiana, please turn your cameras on. Okay, looks like everybody is going with option A, and that is 100% correct. Now, once again here, these are beta adrenergic agonist, and then opposite are antagonists, right? So once you know the one side, the other one is opposite. So agonist, they are your A, albuterol, salmeterol, terbutaline, isoprostol. They are called beta adrenergic agonist. What they do, they act on beta receptors. Beta receptors, they stimulate the beta receptors in the body. Okay, what condition they're used for? Asthma, COPD. Now, what do? They cause bronchoconstriction or bronchodilation?
Bronchodilation.
Bronchodilation, because asthma, COPD, they have bronchoconstriction, and you're causing dilation, so they have better air exchange, right? Okay, good job. Now, if your patient is taking, for example, albuterol, right? Albuterol is short-acting beta agonist. Your patient in the beginning, for first few uses, they may feel a little bit of pace in their heart rhythm, okay? Heart rate might be a little up and maybe slight tremor in the hand. That should go away after a few uses, okay? Next. Now, these are antagonists. The beta adrenergic antagonists or beta adrenergic blockers are simply called beta blockers. Remember what I told you? What do they end with, beta blockers?
Oh, LOL.
LOL. And option B fulfills that criteria, right? Propranolol, atenolol, carvedilol, asmolol. There you go. If you know this, you got your answer, right? Now, in beta blockers, there are two types of beta blockers, okay? Selective and non-selective. Selective means they only act on the heart, right? Hypertension, high blood pressure associated with heart, right? So you need focused action. That means you select focus selective one, only at heart. But if they're non-selective, they can cause an opposite effect on lungs. We don't want that. Because what if your patient has asthma, COPD? That's the reason that you do not give LOL, your beta blockers, to asthma, COPD patients. If you have to, there are no other options, go with the selective one so that they do not target the lungs, because in lungs they cause bronchoconstriction. Patient will have worse symptoms. Okay. Any questions so far? Everybody's okay? Okay. Next. Let's see if you remember. We did it. Should be easy, easy. Come on, come on, come on, come on, come on. Yeah, we did this before. Okay, A is the correct choice. Okay, Zosin. And what is the biggest concern if your patient is taking this medication, guys?
Hypotension?
Hypertension. Brilliant. Okay, here you go. Once again, let's see if you remember. Quick, quick, quick. Easy, easy, easy. Breezy, breezy, breezy. Easy and breezy. We just did that. Okay, I think you got it. All right, B, ending with LOL, LOL, LOL. Okay, okay, and okay. All right. Let me give you a little tip.
I have a question, Professor.
Yeah.
So in this one, A and B, they both look similar, right? They both end with LOL. So how can I tell?
Oh, you know what? I mixed it up. I'm sorry. Yeah, you're right.
That's why I was confused. I
Okay.
chose.
Okay. No. There's one difference. Remember, the answer question is non-selective. They're selective and non-selective. Make sense? Selective and non-selective. Remember, I told you there are two types: selective and non-selective. Now, how do you remember? Anybody knows how to remember if you come across a question, which one is selective, which one is non-selective?
So selectives are going to target heart, you said?
Yeah.
And non-selective will be targeting like lungs.
Yeah. So do you know both, not just lungs, like the unwanted effect that along with the heart, they will affect the lungs as well. But do you know any way to remember or identify which drug is selective, which one is non-selective?
No.
Okay. Now here it might be mixed up in here, but let me give you a little gentle tool. There are a couple exceptions, but in general, write down two things for selective and for non-selective. If your drug first letter is A through N, okay, A through N, that is selective. O through Z, they're non-selective. Okay, is that easy? A
So
through
you
N
said for
selective.
A through N?
A through N. If their name starts, the first letter starts A through N, atenolol, whatever it is, right? Then they're selective, and The others majority, they are non-selective. You may come across one or two exceptions, but they throw simple names in there. You should be able to identify by doing so.
But then nausea start with N. That should be selective, right?
What is it?
The B option, nausea. Oh, this is another question. Sorry.
Nausea is not a drug, right? Okay. All right, it happens. It's okay. All right, next. Come on, come on, come on, come on. Let's see. We get them pace up, pace up, pace up. We have a lot of questions. Denise, we don't have an option to ask question, okay? In the exam. There's no question mark there. Okay. All right. It doesn't hurt to try, right? Okay, so D is the correct choice here. Okay, reason. Why?
Oh,
The patient take,
this
yeah,
liver.
jaundice, yellow color, dark color, clay color stools. That is the sign and symptom of jaundice. And remember, Tylenol, biggest concern?
Liver.
Liver. And why hydrocodone acetaminophen? Because it's
They also
narco,
contain.
but it has acetaminophen in there, right? Everybody understand that?
Yes,
All
sir.
right. Okay, next. Now they're saying if the patient has a risk of hepatotoxicity, which is liver toxicity, right? Then hey, like you told us, you cannot take Tylenol, but hey, what can I take? Okay, so looks like everybody's going with option A, NSAID. Absolutely correct. Now, can you tell me which condition the patient has who should not be taking NSAIDs?
Renal dysfunction?
No, bleeding problem.
Bleeding is one of the biggest concerns, GI bleed. Second is cardiac patient, okay? No NSAID for cardiac patients. For them, give them NSAID. I'm sorry, Tylenol. Okay, next one. Patient given ibuprofen for pain. What is the wrong one here? They need further teaching, further teaching. Is that good that they should be taking ibuprofen with food? Yes, right? That will reduce the GI upset and bleed risk. Can take as much as ibuprofen I need if my pain get worse. Can they take as much as? So B is the correct answer, but the wrong choice, right? That they don't understand that correctly. All other option avoiding if they have noticed black tarry stools. Once again, that's sign and symptom of GI bleed. Okay, next.
Usually the maximum dose, how much is it? 2,000 something?
I believe it is 3,200
Okay, thank you.
for ibuprofen, and I think it's I
40
think it's
gram
three.
for
It's
Tylenol.
3,000 for your Tylenol. Okay, yes, correct. You guys are absolutely right. B is the correct choice. Okay, great. All right, next one. Patient given buspirone for anxiety. Which statement where the patient indicates the need for further teaching? I see majority C's. There's one or two A's. The correct choice is C, guys. Okay, let's talk about it. First of all, anxiety. We were talking, we're looking earlier. There was a drug, benzodiazepine, right? That's usually given for anxiety, right? Which works quick. But buspirone is a non-sedative drug which does not act quickly. Not for acute condition, but it's non-drowsy. Okay, so we need to know these two factors. So the wrong one, when they think that it will work immediately, it won't. It'll take time. It may take 2 to 4 weeks. Okay, but this is non-drowsy one. So they don't have to worry about the sedation part. Okay. Don't try to know just the correct option. Know all other options as well. What is the priority assessment here?
Breathing.
Yeah, and breathing is assessed by respiratory rate, right? Respiratory rate. Good job. Next. Okay, we can see everybody's moving in the right direction. Yes, correct, correct, correct. C is the correct choice, guys. Saying if I start feeling increased pain, I can apply a second patch until the first one wears off. No, no, and no. Only one patch at a time. At non-hairy, non-irritated skin, right? Dry, non-irritated skin. And only one at a time. Okay. This is an easy one. Okay, I can see BDD, DBB, BDBD. So answer is D here, okay? This patch is good for 3 days. Fentanyl patch is good for 3 days. And you may come across in practice like patient with chronic pain, usually given for chronic pain. And these are highly potent. Even, a patch thrown away after using it for 3 days can kill somebody. It's that highly dangerous, okay? Pets and all that, it should be securely, safely disposed away. It can kill anybody. Now, these patches are used for chronic pain, like, patient with cancer or like, your chronic back pain, like some back injuries and stuff, cancer patients, very common. So you need to make sure they understand how to use it, where to apply, never apply heat on it because that will increase the absorption and then they can suppress their CNS respiratory rate. Okay.
Professor, how do you dispose the medication correct way?
So usually you should have a a medication disposal container for these type of drugs. Dispose in that, and they should be disposed or dropped off at a disposal site. Okay, if say worst case scenario, you don't have the container and you cannot just put it somewhere because you have kids or pets or something, and flush it in the toilet. That's the only other thing you can do. That's not preferred way of disposing it. Don't just throw in the trash or anything and the pets or kids get hold of it. Respiratory depression. Okay. All right. And if your patient is, take for example, on chronic pain, they're taking this medication because it works for 3 days, right? Manages the pain well. But you will come across patients after second day, they're saying, you know what, it's been helping me from recently. I'm experiencing that after 2 days, the third day goes hard, like I still experience some pain. It wasn't the case. Now the patient developed tolerance. Okay. Then what you can do is you can talk to doctor. Doctor most likely will give them a medication, an opioid, maybe immediate release because they feel pain now. So you give them immediate release of the medication, which can give immediate relief at that time. Okay. All right. Opioid medication. Now here, the trick, remember, look into most common or most severe, okay? You will see questions or most common, most severe adverse effect. So don't jump quick. I see some jumps. Remember, guys, find the keyword. It says most common adverse effect. The most common adverse effect is constipation. Okay, constipation is the most common adverse effect. Know these tricks, okay? Understand, they're playing here with your mind. So slow down, read it twice. And you know the problem, solution is like, hey, drink more fluids, consume more fiber. Problem solved. Okay, next now. Here, opioid medication was the most severe adverse effect here. Okay, most severe with opioid, no matter what, it is going to be respiratory depression. Okay, that is the highest priority. That's the highest priority, respiratory depression. So anytime before you give them the next dose of an opioid, assess patient's respiratory rate. Very important. Okay. The patient is old, given an opioid for chronic pain management. What do you think, which option we should select, which fits with that criteria, which requires further teaching? Now, this is a little tricky question, okay? Let me go over that. I will use a walker when I feel unsteady while walking. Now, we know that you can put your patient at risk of fall, right? So using a walker, good, correct? That's safe practice. I will take my medication before bed to avoid being drowsy during the day. Now, taking it at night, is it going to do anything about the drowsiness? That is the option here, B. Okay. I will remove loose drugs and clutter. Yeah, perfect. I will ask for help if I feel dizzy, lightheaded. Perfect. All other are correct. B is not clear here. So B is the right answer. Okay. Next question. Now, what if your patient, you suspect that an overdose of morphine, which is an opioid? What is an anticipated medication? Antidot. Very nice. Okay, great. Yes, naloxone is the drug, which is an antidot. What is flumazenil? Anybody know? A option. What is that? NEIDEA. No. No. Okay, flumazenil, it's an antidot for benzodiazepine. If somebody's overdosed with benzodiazepine, that is the drug. Okay, atropine, it's an anticholinergic. It's used in bradycardia. Patient has really low heart rate. You need to jump it up. Then protamine, anybody knows what is protamine? Now, some of these drugs, they're not going to be in this exam, but hey, I put it here so that you know it. It's somehow it's going to be somewhere.
Reverses heparin.
Yeah, it's an antidote for heparin, HP. Okay, another computer brand. Remember that HP, heparin, protamine. Okay. And similarly, you can remember weak, WK. That's for warfarin and vitamin K. Antidote for warfarin, weak, WK. Okay. Neuromuscular blocking agent given to patient who's going for surgery, okay? So what it's gonna do, how it's gonna do, do. Okay, let me share it with you. This drug, neuromuscular blocker agents, they're used before the surgery to prevent some sort of trauma, okay? So B is the correct choice here. They prevent the acetylcholine from binding to the nicotinic receptors on the muscle cell. What do? They prevent the initiation of muscle contraction, which leads to muscle paralysis, temporary. Because when you are, for example, the patient is going for surgery, they need to establish an airway, okay? And when you do so, it's like something foreign you're pushing in. The body responds and it causes trauma. And you cause that temporary paralysis so that the muscle don't respond to that and do not cause that trauma. Okay, temporary paralysis of those muscles. Yes? Okay. All right. So medication here, sumatriptan. What do you think that is? Which class it belongs to? You guys know what it's used for? Sumatriptan? Sumatriptan, rizatriptan.
Migraine.
Yeah, migraines, yes. And I'm seeing majority of you answering B. That is correct. They are serotonin receptor agonist. Okay. Now, serotonin receptor agonist. So they are going to increase that impact effect similar to serotonin. So you have to make sure don't give anything else which can increase the level of serotonin, because then patient may experience serotonin syndrome. Okay, you have to be careful. Okay. Come on, come on, come on, come on, guys. Let's move quick. Let's move, guys. Okay, now here the answers are everywhere. A, B, A, B, A, B. A patient who has migraines, given an OTC, healthcare provider now gives sumatriptan, Imitrex. Which statement indicates need for further teaching about that? Okay, now first one says I will take this medication as soon as I notice migraine symptom. That is the ideal direction. It should be taken at the first sign, as soon as they experience, otherwise it won't help. Number two, B, I can take another dose in 2 hours if the first dose does not relieve my symptoms. Okay, well, that is also the correct thing. If it doesn't work, it doesn't help much, they can. Okay, then I should take this medication daily to prevent my migraine. That is the right choice here, because it's not taken daily. It's only as needed. Make sense? This medication is not scheduled. It's only as needed at the first sign of symptom.
Professor, can the patient take it in 2 hours? Like
in 2 hours, if they took a dose, and in 2 hours, if they still have, yes, they can. Okay, but they still have to keep an eye on the total daily dose. But yeah, they can take another dose if needed. But it's not scheduled.
But it's asking us for further teaching. So it's asking us what the wrong and what the wrong.
And C is the correct. C is the right choice here, means the wrong answer, right? I should take it daily. You should never take it daily. That's what requires further teaching. Okay, it's not scheduled for dose daily.
Professor, regarding that, I'm just I just had a thought because I've never seen it for every, like, if we give a dose for sumatriptan, it's like usually I've read that it's all every 4 hours, like if it doesn't work.
Okay, but anytime you see that, it will show like, okay, after 4 hours or 6 hours or whatever it is, but it should say at the end PRN, as needed. It's not that BID, TID every 6 hours like that. It has to be written as needed only. Okay. If you see prescription that way, question it. Okay. That's not the right directions. Okay, what do you think? Come on, come on, come on. Okay, so looks like a block is here. So let me tell you, B is the correct choice. St. John's wort. This guy is not friend with anybody. Okay, wherever you see, look around. If there is any problem, this is a troublemaker. St. John's wort is a troublemaker. Doesn't go well. Okay, it will increase the level of serotonin. Patient will be in a bigger trouble. Okay. Now, you a super nurse educating a patient for muscle relaxant. Okay. Muscle spasm. Which explanation best describe how muscle relaxant work? They're asking, how does it even work? Okay, looks like we see a couple of C's and then A, B, A, B, C, A, B, C, A, B, C. All right. The correct choice is a choice C. Choice C. Okay. Reason. So they are used to relieve symptoms of muscle spasm, spasticity, working by depressing the CNS, central nervous system. They reduce the hyperactivity of the motor neurons and leads to a decreased muscle tension and spasticity. Okay. Okay. Patient given lorazepam for anxiety. Now here, look for the trouble, trouble, trouble. And looks like the answers are going in every direction here. So let me go over that. Benzodiazepine, well, they themselves are high risk. And now if you read option A, and as soon as you see grapefruit juice, that is a troublemaker. Same like St. John's wort. Grapefruit juice is always a problem. And if they're throwing cimetidine and all that, they are also can cause issues because they make changes into the enzymes in the metabolism, and that is something concerning here. So these benzodiazepine, for example, here lorazepam, Ativan, it is metabolized in liver. Okay. And the gentleman who's responsible for that, it's an enzyme. It's called the CYP450, cytochrome P450, CYP450. It's an enzyme. Okay, and the enzymes are the one which are responsible for metabolizing these drugs. And then some of the enzymes, what they do is they inhibit the pathway, or some of them they increase that. Okay, they inhibit or some promote. And if there are too many of the enzymes, well, those enzymes will metabolize the drug quickly and therapeutic effect will go low. The drug will be excreted quickly. On the other hand, if they decrease the number of enzyme, well, there are less enzyme available to metabolize and making them available to excrete. The other drug is circulating in the system, which can cause toxicity. Okay, so they can impact. Same with your cimetidine, erythromycin, they can do the same. Okay, and if that happens, well, there will be increased effect of lorazepam, more sedation, and that itself, in normal circumstances, your benzodiazepines are a high-risk drug. Okay, so you're providing discharge treating to your patient, given lorazepam for anxiety. Which one seems like requires further attention? Okay, great. Yes, C is the correct one here. Should not abruptly stop these things. Patient is going to experience withdrawal symptoms. Okay. Next. So you're reviewing a patient's medication list, and there's a prescription for muscle relaxant. Which one do you think are muscle relaxants here? And as I mentioned previously, I'm not going to ask you like this, that you have to see 4 options, but I want you to know the most common drugs in that class so that here, there, somewhere, if you have to identify, you know their names.
With this one, I only recognized one medication in the class, so that's kind of why I picked it.
Okay. You picked up A, right?
Yeah, I just.
And that is
yeah.
correct. That is correct. A is correct one, but see, this is how you learn about more. Like you didn't know, others, but hey, now you'll know 3 more, right?
Yeah.
So in class, I mean, we don't know what they're going to ask about. So we need to know the most common ones. Cyclobenzaprine, methocarbamol, tizanidine, baclofen, most commonly used ones. Okay. All right. Here, patient overdosed with acetaminophen, Tylenol. Now, Tylenol toxicity puts your patient at risk of what? Liver damage, right? So that's important. How can you minimize? You need an antidote. Which one? C. Correct. Now here it says acetylcysteine. Sometimes they write down N-acetylcysteine is the same thing. Okay. All right. Now, do you remember what was the flumozanil for?
Benzodrine.
Yeah. How about naloxone?
Opioids.
Opioid. Okay. Perfect. Okay. Carisoprodol, the brand name Soma. Okay, carisoprodol for muscular pain. Which of the following statement indicates need for further teaching? Now, carisoprodol, muscle relaxant. One of the biggest concern is here sedation, drowsiness. That is a big concern. Safety is a big concern. So the right choice is B here. They shouldn't be driving after taking this medication. No way. That's unsafe. Very dangerous. Okay. Okay, next. Okay, come on, everybody. We just talked about it. Okay, great. Excellent. Thank you. Yes, B is the correct choice. B is the correct choice. Okay, I almost forgot about one thing before we move on. Did you guys read my announcement regarding the exam guidelines, instructions, at the, on campus instructions, like what can you take, what you not, right?
Yes.
Yeah, thank you. Yeah, please make sure that next time the campus, they were like, like this, there were too many things. So make sure you go light, okay? Go light. If it's cold, then get like a very light jacket, okay? And then none of the electronic devices are allowed. So I believe you have to scan something or log in or something, right? For the exam there. So then put it away, okay? And put it on silent so that you don't cause distraction to others. And have you read it completely, everything? Any question about that? Everybody's clear on that? Yeah, no caps and all that.
Yes.
Okay, perfect. Yeah, please make sure that we follow that 100%, okay? Thank you. Alrighty, next one, guys. Zainab, please read the options. Brenda, are you okay, or I'm giving you headache, causing headache? Like, yeah, the truth is yes.
I'm okay.
I know, okay. I know that I give you trouble, a lot of trouble. It's complex, but hey, that's what got on my plate to give it to you. uh, there's no easy way of doing it. All right, so we all clear that fumazanil is the right one. All right, all right, all right, all right. Next.
Is activated charcoal also an antidote for something?
Activated charcoal are used in certain type of poisoning or toxicity, whatever you cause. What does it do is they insert a pipe, right, in the stomach. So they push in that activated charcoal, which absorb that substance, which is the patient is overdose or causing toxicity, and then they wash it out, pull it out. So it absorbs the drug so that there is less absorbed in the system, reducing the toxicity.
Thank you.
Make sense?
Thank you, yes.
Yeah. Okay, come on, everyone. Advising patient about when to take pain medication. So what is the right approach? Let's talk about it. A, take the medication as soon as possible after experiencing discomfort. Do you think that's correct? It's for pain after. If you take after, while the pain already started, your discomfort, and you may be probably going to need more. And the more you take, the higher the risk of severe adverse effects. Wait until the pain becomes severe. If it becomes severe, you're going to hurt and you're going to take more. Once again, risk of toxicity. Take the medication at a scheduled time, regardless of discomfort. Well, if there's no discomfort, why would you take it? Right? There as needed. And then take the medication when discomfort begins. And that is the right choice. Reason, as early as possible you take, the least you have to take, the least the risk of adverse effects are. Make sense? So as soon as discomfort, don't pain, wait until it becomes severe pain. Take it at early point. Okie dokie. Next. Patient has arthritis, given aspirin, okay? Which statement requires further teaching? Okay, come on, everyone. Try to answer the question. So now here, they're saying aspirin. Now, what is the biggest concern with aspirin, guys?
It's a blood thinner, so bruising.
Bleeding, right? So if they take it with food or milk, well, definitely they will reduce the chance, right? So that is good. If experience ringing in my ears, I should let my doctor know. What that means? What is the relevance?
Toxicity.
Toxicity. Okay. Denise, were you saying something also?
That's a tinnitus should be reporting.
Yeah, remember that. It's called tinnitus. It's a sign and symptom of toxicity. Okay, that's also very important. So when your patient is on this, and if you're trying to talk to them and they say, oh, say that again. I'm sorry, I didn't hear that. Well, do. Think about it. What they're taking.
No, don't open more. Eat it. Eat like this.
Okay, C. Bruising easily is a normal side effect, doesn't need to be reported. Should they be reporting? Yeah, should be reporting. I should avoid taking aspirin with other blood thinner unless directed by a doctor. Absolutely correct. Because you may increase the risk of bleeding. We don't want that. Okay, perfecto. Next question. And NCLEX also asks this type of question quite a bit. It's a common one. Is it 50-year with hypertension? Is hypertension any issue with aspirin? No. A 25-year-old recovering from a viral illness? Any concern? Yes, no, yes. Come on, guys. You act like politicians, like no comment. No comment, guys. Like, come on. Say something. All right. Okay. Here is the answer. B, B, B. Anybody know why B is the right choice?
Aspirin with viral infection can give Ray's syndrome.
Yeah, excellent, brilliant, good job. Yes, anybody who are experiencing signs and symptoms of viral infection should not take aspirin, any salicylates, right? Any salicylates. And that applies to kind of even some of your OTC products in stomach, abdominal eyes, like your what is that? Oh my goodness, why I can't think about it. What is that pink liquid guys use when tummy's upset?
Pepto-Bismol.
Pepto-Bismol. Thank you. You guys are pro. Look, you know more than me, right? Okay, Pepto-Bismol. Okay, so that's also It has bismuth subsalicylate, and that's also same problem. Okay, tinnitus, and then a bleeding, and the risk of this Ray syndrome. Perfect. Good job. Next. What do you think will happen if the patient's supposed to take their seizure medication, which they should, but if they're not taking it? Okay, great. Yes, majority of you answer correctly. C, except maybe one or two. It's called status epilepticus because asthmatics related to asthma. Seizures is not respiratory condition. Okay, hypertensive crisis, no relation. Status epilepticus is something severe that they have repeated seizures, okay, without having full recovery periods in between. And that happens when they're not compliant. Who are the most common? Usually your homeless patients. Okay, that's why they give them like long acting, very commonly injectable so that they don't miss those doses and fall back. Okay, any question? Everybody still awake? Yes. Christie's, yeah, so far. I cannot guarantee
Yes.
from here on, right?
Still alive.
Okay, all right, all right, all right. So it looks like it's 6:53. We're not going to be able to complete all. I think I have like somewhere 90, 95, 100 slides, okay? Because remember, they're 2 weeks modules, right? So when do you want to do the next session? So next Wednesday is what? Is that Christmas or Christmas Eve or what?
No, not yet, right?
I'm sorry?
I don't think next week is Christmas yet.
It is Christmas.
Next week's
Oh, it's
next week.
Christmas?
Christmas.
I'm sorry.
It's the 25th.
All right, all right. See,
Oh, it's
where are you at? Okay. You're tired, okay? You're officially tired, okay?
I forget my days, everything.
Sorry, I have my baby crying and running around.
Yeah, it's exactly next Wednesday. It's the
You
25th.
can scare the kids, like say, hey, look how tired I am of Professor Sra. If you're not gonna stop bothering me, and I'm gonna make you listen to his boring lecture, okay? He's gonna torture you.
He actually listened to your lecture, teacher.
Well, then he's strong, okay? All right, okay. So what do you think, guys? What do you think? What day?
How about Friday? Since Christmas
Right.
is on Wednesday, and then the
Well,
day after, I'm sure everyone
when
wants
is
to
your exam?
rest.
When is your next exam?
January.
January 10th, is it?
Oh,
Yes,
January
January
10th.
10th.
Okay, okay. Then we have time. Okay.
After New Year, for sure.
So then what we can do is we can skip that next week, right? And then we can, you said January 10th?
Yes.
Yes.
So maybe on 1st? What do you think?
But first is New Year. Everybody will be unconscious. No.
Okay, well, understandable. How about 8th? Yeah, I think that'll work for everyone, right?
Professor,
That's
do
a
we have
Wednesday.
a lot to go over? Like if we do have a lot, then we have everything in one day?
We should be able to, but one thing I want to make sure that don't forget about whatever we're discussing now, because there will be gap in between, and then we start like, do you remember that, but you forget this.
Yeah.
Make sure.
If you can send the recording like last time, that would be perfect. I review your video the day before we have the exam too.
I'll compile those videos and send it. I'll see. I don't think in a day or two, but I will provide you these videos before that. Okay, no worries. You will have those videos. Okay, so everybody with me, okay? Everybody agrees? Anybody have any concerns on 8?
Professor.
8 is good, yeah. But maybe one more session, like, I don't know, the 27th, the
I
Friday.
think it's too close to the exam date. It's a lot to cover. I don't think.
I'm sorry, can you say that again? Do what?
Can you hear me, Professor?
Yeah, go ahead, please. Can you say that again?
Yes. I was thinking. I think it's too close to the date of the exam. It's a lot to cover, knowing we have a lot of module and
Okay.
other assignments. So maybe a little bit earlier than that would be great.
So
So
tell
that
me,
way we're not cramping at the very
yeah,
end.
tell me, guys. Look, hey, look, if you guys look, I hope you understand what I mean by that. I told you guys that I'll be there for you guys. Even if you want on Christmas, hey guys, I'll be here with all the lights, okay? So I'm not saying you have to, but I'm saying you need to tell, come up to a day and I'll try my best to be there. You
Can
tell
we do
me.
Tuesday the 30th?
30th?
Yeah.
That is a Monday. That's what you want?
Of December?
That's a Monday.
December 30th is a Monday. 31st is the New Year's Eve. So I don't think the 31st is a good idea, Tuesday.
So then Monday the 30th?
I want to hear from everybody what they think.
Yes.
Yeah, the 30th works. If it works for everybody else.
Professor.
Yes.
It's okay.
I'm okay on the 30th as well. It just I have work starting at 7. So if the meeting is from 5:30 to 7, but if majority of people agree with it, that's okay. I could just go ahead and watch the video that you're gonna post in this on it.
Okay, so everybody okay? Anybody who is not okay with that, who has any clash?
Yes.
Oh my goodness, what was that?
The 30th is fine, and then we'll have another one on the 8th as usual on that Wednesday before.
Yes, if you want, sure. Why not?
Yes, please.
That would be great.
Okay, so let me take a note. Okay, so next session on what did we agree on, guys? 12:30?
The 30th.
12:30.
And what's the next one?
January 8th.
January 8th. All right.
Yeah.
I will.
Same time, I believe.
Yes,
5:30.
yeah, that's fine. That's fine. That's fine. We can do that. I can make sure we do that. So it's 7 o'clock now. I don't want to hold you guys more because then and you don't have the exam. Deadline that you have to complete. So I guess we should kind of put a stop right here. But our next meeting will be on 30th, right?
Yes.
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 30th. Okay. Any other question you guys may have? Me.
Professor, this is just a personal one. While I was looking up the issue, and it was saying that if you can resend the invitation to me, it might be an invitation issue.
Or
that's why my chat
this.
isn't working.
Okay. Okay. Yeah, I can do that.
Thank you.
Okay, let me take a note. Okay. Anything else, guys? Anyone else? Any other question? Anything else?
One request. Is there any way we can change the due date instead of like Christmas Day and New Year's Day to maybe the day after to give us some leeway? Is that a possibility? I'm sure most of us will probably get it done ahead of time, just in case.
The only thing is what happen. Look, I can try to do that, but most likely what's going to happen that if you're not able to finish by then, if it's the next day, it most likely won't be done on that day either. And you're going to fall behind. There'd be too much, and then you're kind of making it tight for that particular week's due assignments as well. That's my thought. But if it makes easy for you, look, hey, I can do that, but I don't recommend doing that.
Yeah, no worries. I just figured I'm sure
Right.
all of us will probably get it done ahead of time. I just
I thought about it, but hey, look, I mean, telling you, I'm not here to make it hard, make things hard for you. I'm here to make simple, easy for you. I know that if I extend it, it may become more complex for you rather than make it simple. And that's why I'm giving you the suggestion that don't go that route. Okay.
no worries.
Yeah, I just cannot recommend you walking in the wrong direction. Okay, all righty. Anything else, guys? Anything else you want to ask, talk?
Thank you, Professor. These videos really help us.
You're most welcome. I'm glad that you guys are able to get something out of it. Look, it's a complex subject, but the first question you should ask is like, okay, do I need to know everything? Be it this subject or any other subject. Always ask yourself, do I need to know everything? The answer is simple. It's called N and O. No, nobody needs to KNOW know everything. Okay, nobody knows to know everything. Let me give you an example. Do we have one kind of doctors?
No.
Why not?
Because they can't know everything. One doctor cannot treat everybody.
It's too
with
much.
it.
Nobody can, right? That's why we have Dr.
Only
Eyes,
nurses.
kidneys, right? You can only so much. And then what they study on? What is their scope of practice, correct?
Yes.
And now question comes to you. What are you gonna be?
A nurse?
No, guys, you forgot something. Super nurse, okay? You're forgetting something. Not a nurse. No, super nurse. Okay, super nurses know what they are doing. You'll find nurses, they're nurses, but while here and there, they don't know what they're doing. I want you to know what you're doing. Don't be scared of these drugs. Okay, you will find nurses working from 20 years, and as soon as you talk about medication, I'm getting late. Okay, so don't be that. Now, when we have clarity that we don't need to know everything, the next question is, well, what I need to know then, right? You need to know what you will be managing, what the patient conditions are. Before you talk about the drug, know the problem. That if it's thyroid condition, hey, what is the problem when we talk about thyroid condition? Either it's hypo or hyper. Remember one thing, there's always imbalance of something in the body when there is a disease condition. Either it's less or it's more, right? Thyroid condition, either they have less or they have more. If it's less, they are called hypothyroidism. If it's too much, called hyperthyroidism. Now, if they ask, hey, well, hypothyroidism, you said that, but what they are? You're like, oh, they're thyroid hormones. Like, okay, tell me the names then. What they are? T3, T4, right? T3, T4, TSH. Those are your hormones. Well, in hypo, which one are low, which one are high? Well, T3, T4 are low, and TSH always hits them. It goes the opposite side. Those are always high. Now, on the other hand, if they have hyperthyroidism, TSH is gonna be low and T3, T4 are high. Now you know the problem. Well, if something imbalanced, right? Something is less or something is more. How can you fix? There are two ways how to fix it.
Take medication?
By balancing it?
By balancing it. And what is the method of balancing it? Something is high or something is low. So how can you fix to bring it to balance? Simple. Which one is low? This one is low, right? To make it high to the balance, what you should do? You need to lift it up, right? Lift with what? Whatever they have less. What do they have less? The thyroid hormones. So you need to give them thyroid replacement therapy like levothyroxine, correct?
Yes.
Now, the other thing here, if the TSH is high, well, you can lift this or you can do both. You can try to bring the TSH down as well. Then also becomes to balance. A very good, this is not actually the best example for thyroid condition to bring the TSH down. A very good example is when there is an imbalance of dopamine and acetylcholine. Remember Alzheimer imbalance? That's a very good, great example of that method. There is an imbalance in the body, know what is wrong, and the drug is going to fix that. And that will help you to remember the mechanism of action of that drug. Okay? And keep making the list every day when you study. Drugs affecting kidneys, drugs affecting liver, drugs affecting eyes, drugs affecting hearing. And keep adding them and then create mnemonics. Those 5-6 mnemonics will make your life easier anywhere you go to give it 100% correct answer every single time.
Thank you.
Yeah, and then same with the antibiotic. I've been telling, practice those memorizing those there, mnemonics for mechanism of action, what they work on, adverse effect, that kind of stuff as well. All right. Okay, thank you everyone for joining, and to hope a relaxing
you for
rest
your
of
time.
your evening and happy
Thank you,
holidays.
Professor.
Enjoy with your family.
Thank you, Professor.
Take care.
Happy holidays.
Happy, very happy holidays.
Bye.
Bye-bye.
Bye-bye.
Bye. Thank you. Good night.
Thank you. Bye-bye.
Bye-bye.